Rajesh Tate, who's a senior gastroenterologist, and he's going to be speaking about managing gut health in the monsoon. I'll introduce him first. Dr. Tate is consultant gastroenterology at the Fortis Virinandani Hospital in Vashi. He is a highly qualified gastroenterologist. He completed his MBBS from the RCSM GMC in Kolhapur, followed by a DNB and DRNB from other prestigious institutions in the country. He has written extensively in his field and has published numerous journals. So, in our first part of the focus on monsoon-related illnesses, we have Dr. Ronak, who is going to be talking about managing gut health in monsoon. Welcome to Health Live at Seniors Today. Doctor, how are you?
Hello.
Yeah, Doctor, can you hear us?
Yeah, I can hear you. So thank you for the kind introduction, sir. Can you hear me?
Yes, we can hear you. We can hear you clearly. Sorry, there
Yeah.
was we were just trying to adjust something. So, Doctor, our session today is about managing gut health, and we've also been hearing about at in your emergencies, etc., in the emergency wards in various hospitals. Uh, this is an issue that is rising in terms of the complaints that doctors are that patients are coming up with.
Yeah. So with the onset of monsoon-related diseases are on the rise. Like we have a lot of patients like dengue, malaria, gastroenteritis. So these patients are increasing now.
And is that on the increase over the years, or is it the same as what it was?
So the number of cases increase every year because the population increases. Like there's no, it's a proportional increase to the population. So as the population increasing, the number of cases are increasing.
All right. Over to you, doctor, for your presentation. Those of you who are here, please send in your questions. Do mention your age and your gender so that Dr. Ronak can give a considered reply. Over to you, doctor, for your presentation.
Yeah. Uh, thank you, sir, for the kind introduction, and thank you for giving this opportunity to interact with the experienced citizens of the country. So I'm Dr. Ronak Tate, a gastroenterologist and hepatologist at Fortis Hiranandani Hospital, Vashi. So we'll be discussing about gut health in monsoon. So the great Hippocrates, who is the father of medicine, has coined the quote that all diseases begin in the gut. So that is why it is very important to know about the gut and the gut health. So this will be the outline of today's discussion. The first we'll be discussing slightly about what is gut and gut health, then important concept of gut-brain axis, what are the factors affecting gut health, what are the signs of an unhealthy gut, and then we'll come to monsoon and gut health and the do's and don'ts of monsoon diet. So what is gut and gut health? So gut is your gastrointestinal system and starts from the oral cavity, including the
Sorry,
esophagus.
doctor. Doctor, sorry. The presentation hasn't been shared so far.
Sorry?
The presentation is not shared so far.
So you can't look at the slides.
No, 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 no. Can yeah. Now it's coming out. Now it's coming. Yeah. That's right. Yeah. You can start it.
So now you can see.
Yes, we can see it now.
Hello, is it visible now?
Yes, it is visible. It is visible.
Okay.
Thanks.
So what is gut and gut health? So gut is your gastrointestinal system and starts from the oral cavity, including the esophagus, stomach, intestines, up to the anal canal. It digests and absorbs the nutrients from the food and excretes waste. So gut health simply means a healthy gut microbiome. So there are about 200 different species of bacteria, viruses, and fungi which live in your intestine, which constitute your gut microbiome. And the total number goes into millions and billions. So these microbes, they help to break down food, turning it into nutrients your body can use. So some microorganisms are harmful to our health, but many are beneficial and necessary for a healthy body. So coming to gut-brain axis, the gut is also known as the second brain of the human body and the gut and the brain are very much interrelated and correlated with each other. So if there is problem in the brain, like the if the mental health is not good, if you have stress, anxiety, other mental health conditions, so these can have physiological consequences such as disrupting the gut motility, that is the movement of the gut and its function, which can result in symptoms such as constipation and abdominal pain. And vice versa is also true. Like if the enteric nervous system in the gut produces neurotransmitters such as serotonin and its metabolites, which can impact the mental health and cause problems such as stress, anxiety, and depression. And it can even contribute to your personal characteristics. So your gut microbiota, it can be hampered or affected by multiple reasons. The birth mode, that is whether you are born as a normal delivery or a cesarean section, the environment which you live in, the drugs which you consume, mainly the antibiotics, if you are consuming regular and daily or antibiotics on a regular use, your age, the comorbidities which you have, like you have heart disease, kidney disease, blood pressure, thyroid. So these can all affect the gut microbiota. The physical activity, the diet which you consume, yeah, whether there is history of breastfeeding or no. So these can all affect the gut microbiota, and it is known as it can cause gut dysbiosis. So we have divided into modifiable and non-modifiable factors. So modifiable are those factors which are under our control and we can take an effort to change them. So they are stress, lack of sleep, lack of physical activity, eating ultra processed foods like canned foods, burgers and pizzas, smoking, alcohol, and regular use of antibiotics. So non-modifiable are not under our control and they include the environment, the age, your mode of birth, history of breastfed or bottle fed as a baby, and the family history. So now why is it important to know about gut and the gut health? So there is a link between the gut microbiota and health. A poor gut microbiome can affect all the systems of the body from the head to toe and it can cause various kinds of problems. So in the brain, it can cause depression, anxiety, mania, bipolar disorders, neurodegenerative disease like Parkinson's and dementia. It can cause thyroid disorders, heart conditions like heart attacks. It can cause kidney diseases like kidney stones, liver disorders, multiple skin conditions and skin allergies. It can cause gastrointestinal disorders like irritable bowel syndrome and irritable bowel disease. It can cause food intolerance, sexual dysfunction, rheumatoid arthritis, autoimmune disorders, various allergies, asthma, osteoporosis. So wide array of disorders from right from the head to toe can be caused if you have a poor gut microbiome. So what are the signs of an unhealthy gut? So you can have multiple gut issues like you can have constipation, bloating, diarrhea, heartburn, weight gain and obesity, multiple food allergies and sensitivities, infections, sugar cravings, skin problems, a bad breath. You can have chronic fatigue syndrome, multiple mental health issues, and autoimmune conditions. So now we come to the main important topic of monsoon and gut health. So the rains are here and we finally have some respite from the scorching heat of summers. However, the pleasant weather also brings a higher risk of allergies, digestive issues, and waterborne diseases as there is an increase in the humidity levels. The rise in water vapor is a good medium for growth of bacteria, fungi, and viruses, which lead to a poor gut health. So, what causes digestion issues due to humidity? So the humid weather during monsoon makes your entire digestive system, including the stomach, pancreas, and the small intestine sluggish, which can cause bloating, that is fullness of the abdomen, indigestion, causing acid reflux and heartburn. It can cause diarrhea due to infections. It can cause constipation because of dehydration and water loss. It can lead to reduced appetite and increased sensitivity, causing multiple skin reactions. So, what are the do's of a monsoon diet? So please opt for seasonal fruits such as lychee, jamun, pomegranates, peach, and plum, as non-seasonal fruits might be ripened through artificial techniques. Eat steamed salads instead of raw vegetables. And in case we are opting for raw vegetables or salads and fruits, Make sure that you eat them as soon as they are cut and don't keep them for long. Wash your vegetables properly before steaming. Improper washing can lead to various bacterial and viral infections. Add desi drinks such as aam panna, sattu, chas in your daily diet. And please refrain from sodas and cold drinks as they only add calories with zero amount of nutritional elements. Include herbal teas in your daily diet. Green teas and herbal teas are a rich source of antioxidants that help prevent cell damage. Antioxidants are very important for the repair of skin, hair, and other body cells. It is very important to stay well hydrated. At least consume 3 to 3.5 liters of water every day. Adequate hydration is very important for a good digestion. Drinking plenty of water throughout the day helps flush out toxins and keep the digestive system functioning optimally. Eat warm and light meals. So, consuming warm meals helps to stimulate the digestive fire, making it easier for the body to break down food. Opt for lighter meals, incorporating foods that are easy to digest, such as soups, stews, steamed vegetables, and whole grains. Try including ginger, garlic, and turmeric in your diet. Ginger and turmeric are powerful spices and that aid in digestion. So these spices have anti-inflammatory and prebiotic properties which help soothe the gut and reduce inflammation. So incorporate them in your meals by adding to your curries or having them in your ginger tea. So emphasize to have fiber-rich foods. So fiber helps maintain regular bowel movements and aids in digestion. Include ample amount of fruits, vegetables, whole grains, and legumes which are rich in fiber. So these provide essential nutrients while promoting a healthy gut. Add fermented food items in your diet. So fermented food items like yogurt, dahi, chas, these are all important fermented items which you can have on a day-to-day basis. So these fermented foods are rich in probiotics, which are beneficial gut bacteria that act as a first line of defense against infections. So they again help in maintaining a healthy balance of the gut flora. Try managing your stress as much as you can. Stress can negatively impact your digestion. During the rainy season, it is important to manage stress levels to promote a healthy gut. Incorporate stress reducing activities such as meditation, deep breathing exercising, or practicing hobbies to maintain a calm and relaxed state. And if it is not helping, then try to consult a psychologist or a psychiatrist. It is very important to be physically active. So engage in regular physical activity like yoga, swimming, walking, which will stimulate digestion and maintain a healthy metabolism. Maintain adequate hygiene. Wash your hands thoroughly and ensure food is prepared in a clean container to prevent infections. Practice mindful eating. Eating slowly and mindfully aids digestion by allowing the body to break down food properly. Chew your food thoroughly and savor each bite. Avoid distractions such as watching TV or using electronic devices while eating, as they can hinder proper digestion. So now these are the don'ts of the monsoon diet. The picture actually says it all. Strictly avoid roadside food or meals prepared with low hygiene. These can harbor infection causing germs and hamper your gut health. Save that spread of samosas, kachoris, and pakoras for only some special times, and that too only if it is home cooked. Fried foods may appear very tempting, but the high oil content can interfere with the normal functioning of your digestive system, might slow the movements of digestive organs, and delay the gastric emptying. This can cause further bloating and heartburn. Avoid salty food items or eat in moderation. Too much salt can cause fluid retention and uneasiness in the stomach. Limit your intake of caffeinated drinks like tea and coffee. Too much of such beverages causes dehydration in the body. Avoid eating seafood during the rainy season. It is very common for water bodies to be polluted with sewage. Thus, there are more chances of sea creatures being exposed to these pollutants. Also, monsoon is the breeding season for these fishes. You are not letting the nature restock what you have been taking out. And most importantly, most fish sold in monsoon are pre-packaged or stored. The last and yet the most important in the list is to not use contaminated water. Always ensure that your water should be either be purified or boiled. Avoid ice from non-distilled water, kulfis and golas to keep stomach upset and food poisoning at bay. Contaminated food water can spread a plethora of infections, including hepatitis A and hepatitis E viruses. These viruses cause swelling, that is inflammation in your liver. The signs and symptoms of these liver conditions do not appear until the virus has passed 2 to 3 weeks inside the body. Doubt the water quality in your area if you have symptoms like fever, fatigue, or pain in the abdomen and seek medical attention. So, what can we expect when we heal? When we heal the gut? So your moods will be better, hormonal balance will be better, there will be reduction in the inflammation and the pain, your immune system will be boosted, your energy levels will be better, your cognitive function, that is your thought process will be improved. There will be less anxiety and depression, less food sensitivities, your skin will be better, and overall risk of the disease will go down. Your seasonal allergies will go down. So happy gut will lead to a happy life. Thank you.
Thank you very much, doctor. Just waiting for thank you very much. Just 1 second, sorry, doctor. There are some questions that have come in. I'm not able to see them. Yeah. Doctor, there are quite a few questions that have come in. The first question is it my work requires me to eat food from outside, and there are times when while I take my tiffin, I'm not able to always do that. I'm required to eat from food from outside. Um, why is it that I've been doing that for the last 40 years? Why is it that it's only now that hygiene levels have gone down?
Now the hygiene levels have gone down the outside food, that you mean?
That's right. That's what he's trying to say. I was trying to figure out what he's trying to say. Yeah. So he
So
basically
if you
he's been going out and eating food from outside for the last 40 years, but it's only now that there's so much control about eating food from outside. So why is that so?
it is not that it has been from now or it has been earlier. Even all these diseases, all the foodborne and waterborne diseases have been there since age old. So it is not that these diseases have come up right now. So maybe the person himself, his immune system 40 years ago and 40 years down the line will be much different. So 40 years before, his immune system will be much better than what his immune system is today. So after 40 years, like if he's elderly, he is more prone to catch any infections if he has any outside food.
Right. We have a question from Mr. Samir Vasavada, whose question is: what precautions in the monsoon for person with ulcerative colitis?
So no different. There are no different precautions that should be taken. Whatever the normal person or the regular precautions that you take, those are the same precautions you should be taking. And please continue your tablets. The patient, if he is on mesacol, if he is on steroids, all those things, those medicines should not be stopped. But there are no extra or special precautions which should be taken, especially for a disease like ulcerative colitis.
Doctor, this is a question that has come in from a reader who wants to stay anonymous. He says that I had no problems with my gut before I had COVID twice over in the year 2020 and 2021. After that, every monsoon, every time I have, and even if I'm eating food which is at home, I have stomach problems. Is that a problem because of COVID?
So COVID, in short, was a kind of a viral infection. So what happens is many a times, not per se with COVID, with any other viral or any other infection, it can cause a syndrome known as post-viral or a post-bacterial irritable bowel syndrome, in which the patients can have conditions like mild abdominal discomfort, bloating, altered bowel habits. They can have sometimes have diarrhea, sometimes they can have constipation. So it is mainly reactionary to the primary illness. So it is not per se to the COVID. It can be happen with any other viral or any other bacterial infection also.
Doctor, there's another question that has come in: is are gastric concerns also a question of hereditary? Because my father and my grandfather had, uh, stomach aches, acidity, and had problems of gases. Is that also a hereditary problem?
No, no, not really. These problems are not hereditary. So if you are following a good diet, if you're following a good lifestyle, and if you're consuming good water, then I don't think you should be having a problem with your stomach issues or any gut issues. The genetic problems, like if you are having, say, about cancers or pancreatic cancers, they can all be genetic and familial. But these issues usually don't tend to be running in the family.
Right. Thank you. We have a question from Rashmi Verma. Her question is: what is the cause of dizziness or sleepiness just after taking meals? Uh, Secondly, uh, after eating food, I have to rush for motions.
So to answer the first question, so after you eat, so your body has to digest that food. So maximum blood supply is concentrated in your stomach at that time. So what happens is if the blood supply goes into the stomach, the blood supply to the brain is reduced or it is partially compensated. So that is why you feel slightly dizzy and slightly, sleepy. What was the second question? The second about why is to go to the washroom immediately. So it is known as a gastrocolic reflex. So in some patients or some people rather, not patients, it is common is a natural phenomena. Some people have a aggravated or exaggerated gastrocolic reflex. So because of that, after you eat, sometimes you immediately have to rush to the washroom.
Right. Thank you. We have a question from Vijay Lakshmi Ji. Her question is: what treatment is given for GERD condition in allopathy? Is this condition totally curable?
GERD, it can be curable, but you have to follow certain lifestyle modifications also. Like if you have a GERD, if you have a lax sphincter, if your sphincter is loose, the sphincter which connects the stomach and the esophagus, so that can cause a hiatus hernia kind of a picture. So if that is loose, it is very loose, then you might require a surgery. So that is one aspect. If it is not that loose, the common things which you can follow is not sleep immediately after a meal, like at least sleep 2 hours after a meal so that your food, the motility will carry the food ahead of the stomach and the food will not get regurgitated or refluxed into the esophagus. And also not to have too heavy or too oily food, and not to have too much food at once, like have small frequent meals, and don't have too oily or too heavy food which will cause the food to come up into the esophagus causing symptoms of GERD.
Okay. Uh, Doctor, this is a question that somebody has asked who says that I had asked this question earlier as well, but I'm not very clear. Is it safe to have isabgol, and should it be had after meals or before meals? And should it be had with water or with curds?
So isabgol is nothing but a fiber, and it is quite safe to have that. So isabgol you can have any time of the day. It is not that you should have it at night, before food, after food. You can have it at any time of the day. So to have it with water or curds, some people when they take isabgol, they have a problem of bloating. Like whenever you take more of fiber, it can cause more of a bloating or a gaseous distension of the stomach or of the intestines. So if you have it with curd, it is more palatable. So if you are having a problem with taking it with water, you can mix it with curds and have it. There's no problem. So the palatability aspect will improve with that.
All right. Thank you. We have another question that has come in. This is from Mr. Hemant Raste. His question is: what causes hepatitis A, B, C, and E, etc.? Is it due to irregular diet for had over for a long time?
So A and hepatitis E, they are food and waterborne infections. So A and E is usually because of consuming unhygienic food and water. But hepatitis B and C is completely unrelated to hepatitis A and E. So hepatitis B and C is mainly because of your it can be parental transmission. Like during childbirth, it can be transmitted. It can be transmitted because of your sexual contact or because of during surgeries, during blood transfusions. So or using common razors if person is infected with hepatitis B or C, like blood contact or body fluid contact. So these are the ways which B and C are transmitted, and A and E are mainly food and waterborne diseases.
Right. Thank you. We have a question from an anonymous attendee who asks, how does one differentiate between common digestive discomfort or something more serious?
So if the problem is static or if the problem is mild, if it is going on for many years, it will tend to be, it will be something which is silent or something which is mild. But if the problem is aggravating over the few maybe weeks or months, if you are having weight loss, if you are having anorexia, if you are having black colored stools, if you are not able to swallow, so these are all the alarm symptoms or the red flag signs which we say in the GI system, which you should be aware of, and you should report to the doctor if any of such symptoms occur.
Doctor, this is an interesting question. Doctor, every year in the summers, because of watching cricket, too much of cricket, I end up having a lot of bad food. Is there something that I can do? Because when you're watching sports, you want to enjoy good food and you want to, celebrate with your friends and family. What is it that one should eat to be able to while watching television?
Stop watching television would be the easier answer here. And stop watching cricket. But it is more to do with the personal habits and personal cravings. You can opt for a healthier cuisine also that time, even if you are with your friends or family. There are a lot of healthier options which are available now. You need not go for fast foods, or if you have it once in a while, like once a month or so, that should not be a problem. But you are having it on a daily basis, then it's a big problem.
Like doctor, right now I'm having this makhana or fox nuts, as they say, which
It's it's a very healthy.
give me company. We have a question from Katie Dadanchi who says, Doctor, my 78-year-old husband moves his bowels just 2 or 3 times a week now, which was not the case 2 years, 10 years back. Is it okay or should he take Tremafin daily? Any food in particular that can help him?
So basically, constipation, there are the various types of constipation which are explained in the book. So it is very important to know whether does he have the urge to pass stools? Is he passing very hard stools? Does he have straining while passing stools? Does he use any manual maneuvers to remove the stools? So these are all questions which need to be asked to understand the pattern of constipation. So only moving bowels 2 to 3 times a week can be quite physiological also, and he did not worry if he doesn't have all these other features with him. And to answer the other question, you can increase the water and the fiber content in your diet. You can have more amount of fibrous foods like green leafy vegetables. You can have salads, green salads. You can have papaya and fruits like mosambis and oranges, which are high in fiber content. So these will maybe help in your gut
Right.
motility.
Thank you. We have a question from Mr. Bridge Duggal, who asks, we take lots of medicines at this age. How does gut health get affected by that? How do we take care of the gut, given the
Yeah, so
number of
commonly patients, commonly at elderly or senior citizens are usually have common problems like hypertension, diabetes, kidney diseases, heart diseases. So a lot of these medicines can alter your gut movement. Like many of the medicines, like pressure medicines, can increase your gut movement. So that can lead to diarrhea. Some of them can reduce the gut movement, which can cause constipation. A common medicine, metformin, which diabetics take, it can lead to vitamin B12 deficiency, which in turn can cause problems such as bloating, like which is very, it is a very hidden history, which the patient usually does not give, and we have to ask 100 times, like, and when we test the patients who are on metformin, the B12 level usually comes low, and once we treat that, the bloating is gone. That is, we have seen very commonly. So if the patient has certain problems, so those problems that he has to go and address to the doctor, and doctor will see the drug history, and the doctor will attribute it to the drug according to the problem which he has.
Right. One last question, doctor. We have Dr. Suresh Tate, who's 72 years. 2 years back, he had undergone bowel replacement surgery and therefore under medicines for blood thinning and on BP. He's facing uh, issues of constipation during the whole night, facing a lot of problem of gases. He doesn't eat oily or fried food. He exercises and remains active during the day. Uh, his question is, please advise on constipation and passing gas during the night.
So then he will have to take some medicines. The polyethylene glycol is one of the safer medicines which you can take for constipation, and you can consume it like one or you get a sachet or a powder. You can consume one or two sachets at night or scoops, or one or two scoops along with a glass of water at night. That is quite a safe medicine for constipation.
Thank you very much, Doctor, for being here. We've actually answered quite a few questions already. In this short
Yeah.
space of time. Um, it's been a very enlightening session. Your presentation was very good, and we've been able to answer quite a few questions. Once again, thank you to you and to the Fortis team for facilitating this. And we will be back once again next Saturday at 5 p.m. As I mentioned, it will be another of our two sessions that we are having. Today's session was the first on monsoon related illnesses. Next week, it's about cold, cough, sardi, khasi that a host of people complain about. And that special session will be at 5 p.m. as well. Uh, those of you who would like to pre-register for all our health webinar sessions, you can do that. The link is in the chat window, and just enter your details, and we will be in touch with you every week with details of our health webinars. Of course, if you don't do that, you can always access our website and get information on what we are doing, and you can always participate in. As always, my message is to remember we have an Evergreen Club, and that can be downloaded on your Android and your Apple devices. And there are activities which happen every day, twice a day, Monday through Saturday. There is the Seniors Have Talent, which is the season 15 is on. Doctor, we have an event called Seniors Have Talent where people above the age of 60 participate in it. And this is the 15th season that is there. We've had over 1,000 people who have participated, all above the age of 60. And there are people from across the country, and we've had,
Brilliant.
I'll tell you, there are so many people who come there and they give us stories as to how it has changed. There's been a game changer for them, for their lives. So, personally, it is a very satisfying experience. And so that's what we do. We are in a 15th season now. We've done 4 rounds of it already, and that's where we are. Thank you very much once again, all of you. And I know some questions have come in now, but I'm not able to answer them right now. Okay, they're all thanking us for uh, there's one Nilofer Amlani who's requested for the name of the constipation medicine. Can you repeat that?
Polyethylene glycol is the name of the drug. I cannot name a specific brand here, but I can tell you the drug name, polyethylene glycol. You can easily get it in the pharmacy, any brand you can take.
Polythene glycol is what it is. This
Polyethylene glycol, yeah.
this session will the recording of this session will be available on the Seniors Today website on Monday evening. So please have a look at that in case you've missed out on the presentation, or if you would like somebody else to watch it, please look at that. And as always, we have a medical practitioner who looks at who watches this and who does a takeaway, summarizes whatever doctor has said. So that will be there. Thank you once again, doctor, for
Thank you, Mr. Pradyuman, for it was enjoyable to interact with everyone, and the question and answers were really nice.
thank you very much. Thank you once again, and thank you
Thanks
to
a lot.
thank you.
Thank
Bye-bye.
you. Thank you.